I'm really excited for today's video. I have my great friend Trisha Bowman here. She is a Medicare expert. She's very talented, worked there for a long time. She is nation's first go-to when it comes to all things Medicare. So thanks for sitting down and doing this with me. I appreciate it.
Thank you. I appreciate it.
Glad to have you here. So I want to dive right in because I want to get as much from you as I can, because Medicare is always interesting me. There's so much to learn about it and so many different things to know. People have all these questions on it. I have a lot of clients that are on Medicare.
Mm-hmm.
If you have a Medicare plan, a supplement or something right now, how do you know when there's a good time to evaluate your coverage to see if you could be doing better?
Sure. Annual election period is October 15th to December 7th every year.
Okay.
That's the time that you want to start looking with your agent or find an agent that will evaluate if you're on the best plan for you.
Mm-hmm.
Every year there could be changes to Medicare and Medicare plans.
Okay.
So you do want to do a review every year.
Oh, wow. Every year you should be actually
Every
reviewing
year.
your med supplement.
MedSup, Medicare Advantage, and your prescription drugs.
Okay, gotcha. And what's the difference for people who are watching between Medicare and Medicare Advantage? Like, how do you know which one you're going to go on?
Well, Medicare is different than a Medicare Advantage or a MedSup plan. Medicare is given to you from the federal government.
Okay.
It's federal insurance. So if you've worked in the country for 40 quarters, you're given Medicare Part A, which covers all of your inpatient hospitalization, and then Medicare Part B is optional. It is there is a premium for that. This year it's $174.70 per month, and that covers all of your outpatient expenses like doctor visits, specialist, ambulance, and so forth.
Okay.
So that alone covers medical. It doesn't cover prescription drugs. It doesn't cover dental, vision, or other ancillary products. So you want to meet with an expert that can go over your needs, who your doctors are, what special requests you might need for your medical coverage, to determine if being on original Medicare is the where to stay, or to add a Medicare supplement or a Medicare Advantage plan.
Wow, that's really insightful. Yeah, I'm a health agent, but I don't touch Medicare because there's so much to learn. You have to really master it and be really good at it. I've always gotten so much great feedback from whenever you help our clients out, so I appreciate that tremendously. Help me to understand any of the new changes that are going on with Medicare right now. Like, obviously there's some new things with the law. Help us understand what that's for and what that's doing for people.
Sure. It's called the Inflation Reduction Act, and that primarily is towards helping reduce the out-of-pocket for seniors on their prescription drugs. Right now you have what's called the donut hole or the coverage gap. They are eliminating that for 2025. Everyone on their prescription drug coverage will have a max out-of-pocket of $2,000. They're also implementing a payment aid plan, if you will, where the carriers will reach out to the beneficiaries to explain that there's a payment program that they can pay their prescription drugs monthly instead of one large at the time at the pharmacy payment.
Wow.
So it will help spread out their payments for their prescription drugs.
That's great. That's so wonderful. That's why I love having someone on our team here that can handle all this stuff, is up on the new laws, the changes, that knows what to do for people. One last question I have for you, because I get this all the time. If somebody's working and they're 65 years old and they have company health insurance or they have Medicare,
Sure.
How do you help that person evaluate what's the best thing for them?
You bet. So if someone's continuing to work and getting benefits through their employer, they will get Part A from the government. They don't have to take Part B since they already have credible coverage in place, and they don't have to take prescription drug if that credible coverage also has prescription drug coverage. They do want to talk to their employer to see if it would, if they will continue on their employer plan after 65. Some employers don't cover folks once they hit 65.
Okay.
So if they are still working and not quite ready to retire and their employer will continue to cover them, then they can just take the Part A. If they're not going to continue to cover them, then they will want to review Medicare and start applying for Medicare. With that, there's a form and several documents that I can help facilitate. But basically, they have 3 months prior to the month of their birthday. So 3 months prior, the month of, and 3 months after their birth month to apply for Medicare.
Wow, that's so great. So much great information. I appreciate you doing this with me. So if you guys like this video and want more, check out this other video I made on Medicare right here. And if you want to reach out to Trish, what's the best way for them to get a hold of you? Should they email you or call you?
Email me, text me, call me. My phone number is 480-717-1570. Or you can reach me via email at Trisha Bowman, at gmail.com. So it's TrishaBowmanIns at gmail.com.
Perfect. And we'll link that down below for everybody to get a hold of you. Thanks so much, Trish, for being here. Appreciate it.
Thank you.